everyone, and welcome to the PD 190, the Clinical Assessment Online Module. I'm Deepika Ramachandran, the International Dental student of third year. I'm going to give you the brief assessment of how to go about with this. So the aim of this clinical skills checklist is to assess the clinical skills of the interprofessional trainees. The evaluation will be done on 5 major sections: assessment of oral cavity, caries risk assessment, fluoride application steps, anticipatory guidance, and follow-up. So the assessment of oral cavity, the main thing about this is the position of the patient. The knee-to-knee position is the most effective position to assess the oral cavity for infants and toddlers. Other positions are fine, but it is good to be used in various medical and community health settings, whatever gives you a good access. The next examination of intraoral and extraoral, where extraorally we should evaluate for the asymmetry or any swelling that would be present. Intraorally, the tongue, which has a fungiform, filiform, and circumvallate papillae. Any white lesion like candidiasis and thrush should be documented. In gingiva, it should be examined for any redness, swelling. The normal gingiva is firm and pink in color. Any change otherwise should be noted. Examination of lips includes recognizing any signs of illness such as cyanosis, any hepatic lesions, or trauma. As far as the palate is concerned, both the hard and soft palate could uncover thrush. As far as the oral hygiene assessment goes, it is on the scale of 0 to 5, where 0, 1 is low plaque score, 2 and 3 is moderate plaque score, and 4 to 5 is heavy plaque score. The light is when the calculus covers not more than 1 millimeter of the tooth surface. Moderate is the calculus anywhere between 1 to 2 millimeters of the tooth surface, and heavy is something that covers more than 2 millimeters of the tooth surface and it extends onto or below the gum tissue.
Hi, my name is Ramya Naranjan and I am first year pediatric dental resident. I will be reviewing the clinical assessment part. I'm going to be going over the caries risk assessment. So when you have a patient on the chair and you have done the extraoral and the intraoral examination, you have taken a look at their oral hygiene, you have documented plaque, calculus, and how the gingiva looks, how the soft tissues look. The next step that you're going to actually look at is going to be the caries risk assessment. Most importantly, you're going to be assessing the caries risk status of the patient. And how are you going to assess this? First and foremost, if you see any signs of active disease or recent activity, which is like white spot lesion or caregiver having active decay, or if you see a patient having an active restoration in past 12 months, those are automatic high risk categories. The moderate risk is that you don't see any disease activity, where you actually don't see the decay, but when you take a history, you see there's a lot of plaque in the mouth, you see that the patient is not brushing, and when you talk to the caregiver, you find that this patient is totally snacking on carbohydrates, drinking juice, then that's more like a moderate risk. Like with all these factors that are in there, there is no active signs of decay, is moderate risk. Low risk will be absence of factors and decay. For example, if you come across a patient who's brushing like twice a day, who's flossing once a day, has no signs of decay, no plaque, and doesn't snack a whole lot, is an automatic low risk. The next thing that is very important for us as interdisciplinary trainees here is the application of fluoride varnish. It is mainly indicated in high and moderate risk patients. And how are we going to do this is always have the patient in knee to knee. If the patient is within an year old or, a toddler, even a toddler, well, anything that you can actually put them in a comfortable position and you can actually take a look. First and foremost, you need to dry the teeth with gauze. after placing them in a knee-to-knee position. You might not always be able to use a cotton roll for isolation. That'll be ideal, but it is okay. It is well documented that all you need to do is dry the teeth, even if it is not, if you don't use a cotton roll, some moisture around actually works in favor of varnish. You open the packet of varnish, you stir the varnish. Some people like to put a little bit on their gloves and go ahead and paint the varnish. The way we actually teach here in this program is we start with the lower teeth, we paint the outsides of the teeth, and then proceed to go do the inside, and then you repeat the same for the upper teeth. But then as you kind of get comfortable doing this, you kind of develop your own style. You are actually not going to be basically assessed on whether you are actually applying from the outside or the inside, but just making sure that everything is actually taken care of and you actually apply fluoride varnish on all of the teeth. And again, just remember, it's understandable that you might not always be able to use cotton roll for isolation. This is just the standard protocol. If you have a great kid who doesn't mind having things in their mouth, then of course go for it. Otherwise, just using a gauze, drying the teeth with gauze, opening the packet of varnish, stirring the varnish, and painting the varnish. Preferably, you can start off while you are like really just starting off. You can again start off with lower teeth, paint the outsides, but then you can develop your own style. Post-op instructions, with varnish, you always instruct patients not to eat anything abrasive for 4 to 6 hours, and you resume brushing and flossing the next day. The varnish generally is gooey and actually sticks onto the teeth. There'll be a light brown or a yellowish tint that kind of disappears when brushed, and the brushing can be resumed the next day. So the next thing that we are going to actually cover is the anticipatory guidance. This is, you're going to be checked on this, how you actually guide the parent or the caregiver and give them guidance on what they need to do. Most importantly, first and foremost, you're going to talk about the brushing and flossing instructions. Always, cleaning begins at home when the first tooth erupts. Actually, even at birth, you just go ahead and wipe off the gums and the tongue. But most importantly, once you see the eruption of first tooth in the mouth, you go ahead and wipe the teeth. The toothpaste recommendations. You use a small smear that is size of a grain or rice-sized amount of toothpaste in children under 3 years of age. And this is mainly because they don't know how to spit, you don't want them swallowing a lot of toothpaste. The other recommendation from American Academy of Pediatric Dentistry is the pea-sized amount to be used in children between the ages 3 and 6. The next thing that you generally want to counsel parents on is on injury. You encourage the use of mouth guards, that if you have kids who play sports who are older than infants or toddlers, you might want to encourage the use of mouth guards so as to prevent injury to any permanent tooth. You want to encourage helmets if they ride scooters, and definitely car seats for infants and toddlers. You need to talk about electrical cord safety. You know that infants and probably even some toddlers, they keep putting electrical cords in their mouth, and you definitely want to talk about that because that could cause burns in the mouth. So childproofing the house is going to be the caregiver's responsibility. You develop plans for oral trauma management, which means that once the child starts walking, there could be accidents, or they're playing in a trampoline, there could be accidents. So you guide the parents, like what happens if the child has a fall, where to contact, what to do. So that's more of an anticipatory guidance. Next, we talk about the non-nutritive sucking, and that includes either sucking a finger, thumb, or pacifier. It kind of gives emotional benefits to the child. It helps the child remain calm and focus attention. Non-nutritive sucking is okay until the age of 3, after which you would try to break the habit, because then you get to see all orofacial malformations like, maxillary teeth flaring out, the mandibular incisors getting tipped lingually, posterior crossbite, and anterior open bite. In dietary counseling, you definitely want to talk about limiting sugary drinks and simple carbohydrates. It's just not only good for the teeth, but also for their overall health and well-being. You want to encourage eating fresh fruits and vegetables, and definitely cheese, because cheese is great for teeth. Recommend the usage of sippy cup at about 6 months of age. We prefer that the child is weaned off the breast by like 12 to 14 months of age. from between the ages 6 and months to 3, you would see that child may have some sore gums, they might be teething. So you definitely want to talk to providers about teething. Let them know that teething does not cause high fevers, could cause some drooling and some mild discomfort, but should not, there's no reason why teething should cause any high fevers. You definitely don't want, you want to advise caregivers that you don't want to clean their pacifiers or eat from their utensils by putting your mouth in. Your saliva is contaminated and it could transmit bacteria to a child's mouth, which is pretty sterile. And most importantly, the caregivers have to take care of their own teeth so the cavity causing bacteria is not transmitted to the children. When children are teething, you definitely want to talk to them about using a cool teething ring or a spoon, any cold wet washcloth, anything that would soothe a baby's gum. Let's talk about follow-up. Parents and other care providers should establish a dental home for every child by 12 months of age, and period of follow-up visits for high-risk patients. You could see them up to 4 times a year, moderate risk up to 3 times a year, and minimal risk 1 to 2 times a year would do. The take-home points from this clinical assessment checklist today is going to be definitely go over this online module. This is put in here for your reference. We're going to be evaluating you on your clinical skills when you come in for to our clinical session. The user manual contains all the details on what the trainee will be evaluated. It is also available online, and I'm thinking that all of you might have received a hard copy on that. Make sure you record all your observations. Go over the clinical assessment checklist, go over the user manual, and make sure that you record all these observations on your training note, because this is all you will get when you actually go in for your clinical exam. Make sure you document everything that we are going to assess you on, which is present in the clinical assessment checklist. Because if you don't document it here, we have no way to know if you have actually taken a look at things. And the other thing is we'll have our clinical assessment instrument and user manual that is posted on CLE, and it needs to be reviewed. That's it. So I hope to see you guys in the clinic. Thank you.